The One campaign, which is a global advocacy initiative aimed at ending extreme poverty and preventable disease by 2030, is urging African leaders to take part in next week's annual Springs meeting by the World Bank. It's a virtual event of 10,000 people, including government officials, journalists, private sector executives, civil society, as well as academics. The One campaign supports various African finance ministers' pleas to the Bretton Woods system of monetary management to assist with an emergency economic stimulus of $100 billion for the COVID-19 crisis as an immediate health response for the African continent. Now, it's important to note that in South Africa, the ANC-led Tripartite Alliance has rejected the idea of funding from the World Bank and the International Monetary Fund. To discuss this further, from Abuja, Nigeria, we have the One Campaign Africa Executive Director, Edwin Ikoria. Please, Edwin, if I have pronounced your surname incorrectly, please correct me. And he joins us via Skype. Good to have you.
Thanks for having me. It's Edwin Ikoria.
Ikoria. Ecuador. Got it. Thank you very, very much for clarifying. All right, so let's get into the business of the day. Why is your organization taking up this call in support of African leaders?
I think the biggest challenge we've seen so far is that there's really a fiscal challenge on the African continent in terms of adequate resources to fight, the COVID-19, especially for Africans that are really commodity dependent, especially those who are oil, exporting commodities, minerals and all of that, with the fallen prices. So the access to resources to really be able to combat this disease, whether it's in terms of prevention, providing emergency care, and then more importantly, the economic impact of this, especially with the lockdowns and stay-at-home orders as a way of preventing this, is really going to take a toll on the African economy, not just for those who are already poor, but those who are already poor, they further into poverty. And these are in the millions. And when this becomes a social issue, of course, the repercussion is that you cannot eradicate the disease or you cannot contain the disease. And so this is also going to flow back to the rest of the world. Yeah. And that is why we're calling for this support. Actually, we're calling for a global solidarity. We know each country is dealing with theirs, but for here we're asking these international finance institutions to really stretch themselves to ensure that they back African leaders that have these fiscal constraints to be able to respond adequately and then to be able to provide the economic stimulus that the citizens need. Otherwise, we will not be able to end this pandemic in good time.
Yeah. I mean, African ministers of finance are asking for an economic stimulus of, I think it's around $100 billion. The World Bank has already announced a sum of $14 billion. How do you make sense of the huge difference between these two figures?
Okay, so let us get the data. So there is release to start an emergency health response, a response to contain the virus, whether it's in purchase of equipment, purchase of test kits, personal protective equipment, and all of that. It's a bit smaller. But the $100 billion that the African finance ministers are calling for is more of a fiscal support, so like a budget support, and then a key part of that is waiving the debt repayments that are supposed to happen in 2022 particularly, because as you know, many African countries spend as much as sometimes 50% of their annual budget to service debts. And so part of that $100 billion is calling for a waiving of debt repayment. In fact, for some countries that are really, really fragile and really that are not able to cope with this, we're actually calling for a total debt cancellation, especially for those that are in crisis. And so part of the $100 billion is that debt forgiveness, debt repayment, or a moratorium, that, as you would say. The other part is actual stimulus, actual loans or grants with the smallest, with the interest rates that are really negligible to enable the economy's cope. So this is going to include support to the private sector, support to manufacturing. As you can tell, there are several sectors that have been hit significantly. The tourism industry has been hit significantly. Workers are at home, losing billions of dollars. There's no way you can restart those economies without providing stimulus. The United States alone is providing $2 trillion stimulus. So you can understand that what the African finance ministers are calling for is actually a paltry sum compared to what countries are currently providing to their own economies to stimulate the economy. So the 14 billion from the World Bank is basically in terms of emergency health response, which is supporting countries in procuring equipment, procuring tests, and all of that stuff. But the 100 billion is a bigger package that includes stimulus to the economy to restart the economy after the pandemic, or even while the pandemic is still spreading.
Let's look at the African Development Bank, because its president, Akanwumi Adesina, has committed a sum of $10 billion US. Do you think that they can actually do more than that?
Honestly, they have different instruments to use. So institutions, including the African Development Bank, are using instruments that are available to them. So it also depends on the package that they have for such instruments. And this is the reason why we're also calling for refinancing of those instruments so that they have enough of them. The African Development could do more, but the question is what is available for them to be able to use that particular instrument to intervene in this sector. And that's the reason why it is really, I mean, we are all happy to hear that if the World Bank did 14 billion, the African Development Bank 10 billion, you can see the difference. So why we believe they can do more, it also depends on what is available for this emergency response and this, that instrument that they could use to support African economy. But this doesn't preclude them from, other support, bilateral support, or restructuring existing loans, existing grants that they have for African government. We just need to clarify the difference between those.
Yeah, let's now get your assessment of the situation on the ground in different African countries during this period. The numbers are still low on the continent. Lockdowns are happening, and of course the economy is already struggling, but we talk to low numbers because we also have to keep in mind the ability to test, and it has been a very dismal testing situation on the continent. So let's get your assessment at this point.
Yes. So the biggest challenge we have, like you mentioned rightly, is the testing capacity. And right now, what we are seeing seem to be, not overwhelming yet. But even with the current numbers, it is still a stretch for the African health system, because even South Africa is supposed to be the best in the continent right now in terms of the health system and delivery. But talk about the number of ICUs that are available. If so many people get sick at the same time, how will we cope with that? But one thing we should also be careful to just conclude is that if these numbers are still this low generally on the continent, and we are not getting, too many reports or any overwhelming symptoms, because if the people are sick, they will be showing up in the hospitals. The numbers have not really dramatically increased in terms of numbers showing up in the hospitals, for you to begin to think about whether it is COVID-19 that is affecting them or otherwise. So we are still in a relatively better place than most African countries. But the real challenge right now is that we keep down stay-at-home order that we have. The community life in Africa is really, it doesn't really correlate with this system. We live in communities. Many of our people are in informal trade. They engage on daily business, and in they're living daily. So stay-at-home order right now is affecting those millions, much more significantly than even the virus itself. Yeah. And this is the tension that we've been talking about. Say how, in the African context, what is a solution that eases the tension between the effect of the disease or the fear of the disease and the economic impact for the small economies, for the small informal players. This is the main tension that we are seeing. And this is the reason why we are calling for a coordinated response that is Africa-centric, that recognizes the specific social economic characteristics of the African society. Many African countries are coping. Religious service are stopped. This is really not in line with the African social system, because religion is a key part of the African social system. And so we need to think about what is the best way to cope with this that does not really disrupt the life of it. But anyway, it is for a short time. And so we're calling on people to say, look, it's for a short time. If we stay at home, we can make this thing, we can end this quickly. But if we do not stay at home, if we continue with our current system or our way of doing things, we might prolong the pandemic. And this is the major call across African countries.
Yeah, it is a loud call, and it has to be continent specific. So you've mentioned it, and the African leaders also asking that the World Bank give a debt waiver for the year 2020. But let's look further than that. What lessons can be learned from this? I mean, including building our own reserves as Africans and not to have to depend on foreign aid.
Thank you very much. So the thing here is that there is a systemic change that is required. And this systemic change really is, how do we prepare for a future, for a threat like this? And this will include, how do you reserve for the rainy day, as we call them? How do you plan? How do you build a resilient health system that can take care of this? How do you increase a social welfare system that will include more people, into the basket? How do you expand your database, knowing the citizens, knowing where they are, where they live, knowing how they, what the economic situation is, and how to improve that welfare system that enables, the African government, target delivery to these poorest people. This is something that we all need to learn from here. But more importantly is, how do we build a system that knows that the health or the economy depends on the health of the people? And this is why we're calling to say, beyond reliance on aid is, how do we improve our domestic remobilization? How do we reduce corruption and people who are stealing this money? How do we improve transparency in the way resources are managed? These are all systemic changes that we're calling across African countries. And I think the African leaders are fully aware of this. But for this emergency, there's a Nigerian proverb that says, it is not when the house is on fire that you're beginning to think about the cause of the fire. So right now, let's put out the fires, and then let's come back and determine what can we do to avoid this happening in the future.
Just finally, as I begin to wrap and let you go, this annual gathering by the Joint Development Committee and the IMF, International Monetary and Financial Committee, is meant to discuss progress on the work of the World Bank Group and the IMF. We obviously look at a lot of other situations that are making, there's a lot of skepticism about the work that is being done. And we in South Africa, the situation between the Tripartite Alliance and the finance minister are two completely different scenarios, where the Tripartite Alliance basically saying that they don't want the World Bank to come into the country and dictate how we run our economy, which would be, unfortunately, the decision that would come with taking money from the World Bank and the International Monetary Fund. But the finance minister saying he's not sure if we can get through without taking a loan. How do we, what are your views? Let's talk about the skepticism around this.
Okay, I would say that, first of all, now the fiscal requirement to deal with this pandemic and the economic consequence requires that, money is gotten from somewhere. The money cannot fall from the sky. So that is number one. Number two, realize that the South African market has just been downgraded. And for any kind of commercial loans that will come from any other source, they're going to come with very high premium. And so that is the reason why you're looking for concessional funding. And that's what is going to come from the World Bank, the IMF, or which other international finance institution that can give concessional lending. But the most important thing here is this. While they gathered, why this is really important is that to deal with the pandemic, to deal with COVID-19, this is not a time to start calling for reforms, to tie reforms to the loans that are required. This is not a time for that. In fact, David Malpass, the president of the World Bank, had indicated that when countries require or request for these loans, to ask for reforms. And these are the conditionalities that we are saying it's not necessary at this point. Right now, let's put out the fires. And so we are also advocating for the World Bank to say this is not a time for reforms, to be calling for reforms. And so while we understand the fears of the tripartite group in South Africa, we also understand that the reality is that South Africa needs money. And where the money is going to come from right now, the most feasible source is through these international finance institutions. But the rules of payment, because they will definitely be different, because anybody calling for reforms at this point is just being sinister, and that is what we are also speaking against.
We've obviously got the issue, and South Africa being a part of the BRICS countries, and I think when we had a conversation yesterday with members of the Tripartite Alliance, they said that would be a better route to go. Rather take a loan from the BRICS Bank as opposed to going the approach of the World Bank and the IMF. I don't know if you have views on this.
Honestly, if they have whatever option is available to South Africa, they should take. That is the truth. Now, the question is that who are the shareholders in the BRICS Bank? Again, China, Brazil, India, these are also not going to give you money for free. Let's get that clear. They're also going to come with targeted at specific things. And so while we're looking at the development, it's about what options are available for the South African economy. And they should explore all options. They should not exclude. The underlying factor here is which of these institutions will make the resources available in good time, without the conditions or condition of so-called reforms that ties the economy, to the loans or to the funds they're looking for. So in my opinion, the South African government should explore all options, including the BRICS option, but they should not close themselves out completely with a fear, but instead the negotiating power should include, we cannot have tied loans at this point. We need to deal with an emergency. We need to revamp our economy. Otherwise, we will default on existing loans. By the way, realize that there are existing loans at the moment. So if the South African government doesn't, if the South African economy doesn't kickstart, it doesn't get back, then there will be default on existing loans. So there is a very delicate balance that needs to happen here, and I would really implore that people look for those balance, so that everybody's better off at the same time. We can have a win-win situation in this case. That's my honest opinion.
Edwin, we thank you so much for your time. Edward Ikwaria is the African Executive Director of the One Campaign, talking to us about next week's spring meetings and the need for Africa to try to ensure assistance in order to deal with the COVID-19 pandemic. Thanks again for your time.